Hi Stephanie. Today you'll be doing your wound care checkoff, and you're going to be doing it on your patient. In the bed is David Matthews. On the counter there you have your doctor's orders, and I'll be following along with your checklist. So any questions before we start?
Nope, I'm good.
Okay. All right, so you can go ahead and begin.
All right. First I'm going to read the doctor's orders. It says here I have David Matthews, date of birth 3/3/50. He has no allergies. It says daily wet to dry dressing change to coccyx, pressure ulcer, using gauze 4x4 packing, moisten with normal saline, cover with dry 4x4 gauze and ABD pad. Use Montgomery straps to secure. Prior to dressing change, irrigate with sterile normal saline until clear. Follow with wet to dry dressing change. Okay. I gave him pain medication about 30 minutes ago, and I started the normal saline to warm it up to body temperature. So, I'll go introduce myself. Hi David, my name is Stephanie. I'll be doing your dressing change today. Can I have you tell me your name and date of birth? Okay, David Matthews, 3/3/50. Looks good. I'm going to walk around here and pull the privacy curtain. Clean off my hands. Let's get you in a comfortable position. I'm only going to pull this back as much as I need to, okay? There, how does that feel? David, I'm going to slip this waterproof pad under you so we don't get the bed all wet. Put this here to collect any runoff I have from when I'm irrigating it. I've got my garbage down here. Put my clean gloves on. Now I'm going to take off the old dressing. See, it's got yesterday's date on, so that's good. I have an ABD pad with nothing on, no drainage on it. One dry 4x4, and then it's packed with some 4x4s. There's some scant purulent and serosanguinous drainage on it, but not too bad. And the wound itself, it's slightly red around the outside. I can tell it's a stage 4 because I can see bone and muscle. There's undermining, tunneling, granulation tissue. I'm going to measure my wound. I get 5.5 by about 5.5 centimeters, wide and tall. And I'm going to see how deep it is by using a cotton swab. Right there. So that gives me about 1.5 centimeters deep. And now I'm done with these gloves, so I can take them off. And I need to wash my hands after that. I'm going to open up my sterile field. Be careful not to touch anything. Add my sterile supplies. Here is my ABD pad. Syringe. Yeah. one cotton.
The cotton swabs don't always cooperate.
No, they don't. Try one more time. There we go. And my 4x4s. And then I'm going to add my warmed up sterile or normal saline. It's not expired. Pour a little bit in the garbage. And then I would add it to my sterile cup and my 4x4s. But for the sake of this model, I can't put any water in it. And then sterile gloves. And I can't turn my back to my sterile field. Open my sterile gloves. My hands are wet. I can touch the outside of my packaging. Okay, so I didn't touch the inside of it yet.
Right. Since your thumb didn't go over that line, that's okay.
Okay, now put them on. I can touch the cuff. I can touch it one more time without touching the corner. And then I grab this cuff. Careful with my thumb. Sterile gloves are on. Okay, now I'm ready to irrigate my wound, and when you do your checkoff, the syringe and angiocath will be on your tray ready for you to go. So I'm going to stick my thing in my irrigation solution, keeping this sterile and my hand sterile as I irrigate the wound.
Say it again, which part's sterile?
The whole syringe, angiocath, and my hands.
Okay.
So to start, I'm going to start at the top of the wound, going back and forth slowly, asking my patient how he's doing, and being very careful not to touch anything that isn't sterile. So I keep doing this, back and forth. And if I needed to get more solution, I'm able to because I didn't touch anything with my tip, and I would keep doing that until my solution runs clear. So now that I've done irrigating that, I'm done with this, so I can throw it away. And now I'm going to take my gauze, and I'm going to bunch it up like this, keeping my hands clean, dip it in my solution, and start at the top of the wound, make one swipe around. Throw that away, and do another one. On this side of the wound, being very careful not to touch anything with my hands. Go a little bit further out, cleaning the skin. And one more time. Now I need to dry his skin off and do the same thing. One swipe around, throw it away. Further out. and the last one. Okay, now we need to pack the wound, and since I'm still sterile, I can touch this. And remember, this is wet, so I need to wring it out a little bit. And now I'm gonna unfold it a little bit, like that. And you have two options when packing a wound. You can either use the cotton swab or the forceps, it's up to you. I'm gonna use the cotton swab. These can be a little damaging because they're harder, so we don't want to further damage his wound, but either one would work. Then I'm going to come over here and hold my gauze like this because I don't want to touch it to any of his outside skin, which would contaminate it. So I'm going to set it in the wound and just gently start packing it in, making sure I get in all the areas, but not doing it too tight. If his wound was larger or deeper, I could always put in more packing, another sheet, another gauze pad. That looks pretty good. So I'm done with that. Now I'm going to take my dry gauze and put it on top. And my ABD pad, and the blue line goes on the outside. Just unfold this and place it on top. Now I'm going to take my straps and secure the ABD pad down. Again, making sure it's secure but not too tight. And I'm done with my sterile gloves, so I can take these off. Throw them away and wash my hands. Okay, now I need to make sure that I write the date and the time and my initials. Using an ink pen, not a marker, so because we don't want it to rub off. And now I need to put cleaning gloves on and discard all my supplies. So take that, throw it away. Now with my sterile field, I'm just going to move it. I'm going to hold on with these so I can wash my hands. And now I'm going to help him back into a comfortable position. Cover him back up. Make sure his collate's here. Pull back his curtain. And then ask him how he did, if he's having any pain right now. And now I go out and document. Okay, now I need to document the dressing change that I just performed on SimChart. First thing I had to do was put where the wound is at, so on the sacrum, and then you scroll down, and I documented the appearance of the wound and the tissue that's surrounding it, and I added the size and the depth, what tissue is at the wound bed, the drainage that I saw on the gauze, the irrigation solution that I used, the type and the amount of dressings that I used, and how my patient tolerated the procedure. And if my patient had any bright red bleeding, increase in pain, if the irrigation solution didn't come out properly, if I saw evidence of dehiscence or evaceration, or if my patient showed signs of shock, I would let my doctor know immediately. And that's the end.
All right. Congratulations, Stephanie. You passed with flying colors. Great job.